I want to mention one situation that we're also looking at now, because I think it points to how rapidly this thing can turn wrong. We had a cluster of cases associated with a food service establishment in Kona, and that's also being investigated now. Based on our findings, the transmission appears to be limited to co-workers and not to customers, as appropriate barriers and social distancing measures were used to limit the interactions and protect customers. I'm very pleased that most food establishments do have barriers or are protecting workers and customers who are coming to those facilities, and this was no exception. Apparently none of the customers were impacted at all. But among the food service workers, 7 positive cases have been identified, and all workers who are tested positive are now in isolation. All workers who are exposed and without symptoms are also in quarantine at this time. Interesting that the individual who was infected, who undoubtedly or unknowingly infected his co-workers, also lived in a very large household, an extended family, and 7 members of that household were found to be infected and positive for COVID-19, which just goes to show that how quickly this disease can be spread in facilities and, of course, in your home, and why we need to be so vigilant and assuring that we're maintaining our social distancing.
Next question for Dr. Bruce Anderson. This is from Max Dybel, Big Island Now. Have you spoken to or did any of the potentially exposed customers who visited the fast food restaurant in Kona? If not, how can you say there was no spread?
At this time, we don't believe any of the customers were impacted. We can't say for sure, of course, that no one was, but we haven't received any reports of anyone ill as a result of patronizing that facility. Further, I would add that they did have all the safeguards in place. They had shields. They were careful about how they were handing out ordered food. They did everything right. The problem in this case was the individual who was ill, who inadvertently spread the COVID virus to co-workers, which is a very common problem in food service establishments across the country. The face mask that you're wearing, you see food workers wear, is not to protect the food, it's to protect their co-workers, because that's where the real risk is, and of course also customers who may come in. So that is an important feature, and again, I don't believe that there was a significant risk to the customers who have come in given the protocols they had in place there.
Okay, thank you, Dr. Anderson. Another question for you. This is from David Corrigan, Big Island Video News. Please explain how the decision was made to withhold the name of the Kona fast food restaurant where the limited localized spread of COVID-19 was identified, despite the wishes of the public to know this information.
We have not attempted to hide the name of McDonald's that it sold the food. There are 2 McDonald's in the Kona area. They're both closed, and they have disinfected their facility. It's not a secret. We typically don't advertise the name of a restaurant, but if someone wants to know, we'll let them know.
And this is from Daryl Huff from Hawaii News Now. Can you confirm that one of the patients from the Kona cluster was flown to Oahu for treatment, and whether first responders were exposed and or required to be quarantined?
Daryl has some good information. Yes, one of those individuals was flown to Oahu. They're all being isolated.
Okay. Another question for you, Doctor. This is from Audrey McAvoy, Associated Press. Was the Kona McDonald's employee displaying symptoms while working at the restaurant?
I'm not aware of that. Typically, that has been the case. People are most symptomatic most infectious when they're symptomatic, and I would not be surprised if they were. I simply don't have that information right now.
Okay. Another question for you, Dr. Anderson, from Chelsea Jensen, West Hawaii Today. Regarding the Kona restaurant, how many people are isolated or self-quarantined, if you know, and have been tested? How many results are you waiting for? And will the state conduct additional testing in the coming weeks to track any communities?
We have a total of 14 individuals who are being isolated now because they were positive, COVID positive, and other contacts have been identified. Everyone who we believe is a close contact is being quarantined at this time. We'll have more results in a few days, probably on the additional sampling that was done associated with the outbreak. But we do have 14 total to date, including 7 workers and 7 family members.
Are you testing all close contacts with or without symptoms who are part of the clusters on Maui and Kona?
Yes, short answer.
Okay.
Let me also add one thing, that when I talked about these 2 clusters, these are existing cases that had been reported. There are no new cases here that I'm talking about. I'm describing the circumstances where the cases that we've reported were infected. So this isn't to say that we've had more than the number of cases that I've just discussed. I thought I'd provide that clarity.